I am Carol Thomas. I'm a gynecologist. I sit in private practice, but I have straddled the worlds of public service and academia, as well as the NGO sector. My passion for women's health is obviously something that I carry within my work. I'm a women's health advocate, and over time, I've developed a sense that there are better ways to do some things, and that they're not always reliant on our formal health services. I hail from Elsie's River, and as a black, previously disadvantaged woman, I have a good sense of what's happening in our communities. Historically, we have disadvantages in the healthcare service in this country, and it is extremely difficult to use traditional healthcare models to service 84% of the population. The prevailing socioeconomic environment that we find ourselves in means that women bear a disproportionate burden of disease and unemployment. Pregnant women bear an even greater burden. The greatest challenges that face pregnant women in determining whether they live or die during childbirth relate to HIV, to bleeding in pregnancy and labor, as well as high blood pressure. It becomes very important to think in new paradigms and to develop different models that may well be more patient-centered, and in my case women-centered, when you use design thinking to develop a manner of servicing sections of the population. This is not something that would be contrary to the normal health services that we have, but complementary, and yet at the same time be supportive and empowering and capacity building. We have got to the point where we now have an enabler in the form of technology. We have a large unemployed labor force. And when you marry all that together, you have the scene set for a concept like iMobiMama that can address the needs of pregnant women. Currently, the iMobiMama suitcase is an onboard wheelie, which contains, amongst others, a blood pressure monitor, a scale, urine testing equipment, a fetal heart detector, as well as a 3G 7-inch tablet, which is used to push the data to a central hub where it's monitored by health professionals like myself or other midwives. Our research to date has shown that the most desirable format that this kiosk should take is a collapsible one, which could be pulled by a bicycle, was considered, as well as a Sedgway type device kiosk, which could in fact charge the electronic devices when pulled along. Women in the communities are trained in business skills, retail skills, how to use IT equipment, and basic clinical skills so that they can take blood pressures, check urine, and check weights of pregnant patients. To date, I have funded this myself, with the exception of $10,000 from SAB Foundation. The development of iMobiMama has been a modular process. The stage that we are at now is to develop a prototype and to test it in the field. So I've always felt that one should be able to marry the mandate of government with the philanthropic intent of NGOs with a business model that works. And it's for this reason that iMobiMama is not an NGO, although its outcome is good social impact and job creation. The idea is to make it so sustainable that there is value added at every point of contact. With the correct leadership and support, iMobiMama has the potential to go to scale. There are 250 antenatal clinics in this country, not always as accessible with flexible hours. Each clinic could be supported by a minimum of 5 iMobiMama kiosks, and each kiosk would give economic opportunity to at least 2 women. So immediately there is a potential for 2,500 jobs. Other than that, these kiosks will be servicing a number of women with basic, important antenatal care and give them access to products that they may not be able to access generally in the community. I believe that the health of a community converges with the possibility of a viable, sustainable business. iMobiMama is such a project.